how has COVID-19 affected you, your family, and or your community?
Okay, I'll say that personally, it has not affected me in any way, except that now I'm working remotely full time.
Okay.
You know, our job just decided that it was better to have everybody at home, so they wouldn't be having to travel and to, you know, get the disease. Um, so I would say that personally, I have not been affected by it. Family wise, no one has gotten sick. You know, no one has gotten been in any kind of danger
Okay.
because of it. So we've been blessed that nothing has happened to us or our family. Community wise, I'd say that because I'm stuck in my home office full time, I barely go outside except to, you know, to go to the Y to do my classes, or go to the supermarket. But that's as much as interaction I have with the community. You know, I really don't go out much. You know, I prefer to stay home,
Yeah.
and I have my dog to keep me company. You know, so
No, that's always a good thing too.
yes.
So have you been vaccinated for COVID-19?
We have, you
Okay.
know, yes, the whole family has been vaccinated just because
Okay.
we want to make sure that we're protected, you know. So yes, we've all been vaccinated.
Good. So what was that experience like from getting the vaccine, like making the appointments and to receiving it? What was that process and experience like for you?
I would say that the first two were harder to find. You know, the first two vaccines, the series of vaccines that you needed to get, that was a little harder way back when. I would say maybe 2 years ago, maybe a year ago. That was, I thought it was much more difficult to try to get the vaccine from a pharmacy. You know, Miggy did the research and she got us the vaccines. So we're both vaccinated.
Okay.
Now with the booster, it's a lot easier. You know, I have Walgreens and they provide the information and you can go on the app and schedule your vaccine. So no issues. Today I had my third booster. So, you know, so far so good.
Okay, great. So, did you have an opportunity to talk to a healthcare provider about the vaccine? And if you did, what did that conversation look like?
Well, I work for a prescription drug administrator, so I have our internal pharmacists. So they're the ones who conducted a meeting for the whole team, for the whole company, providing information as far as the COVID vaccine and how it's beneficial to you and to the community. So there was no question that I wouldn't get it. You know, it was a matter of just being able to, you know, get on the app and sign up for it.
Okay, so
So
was that I guess the only place where you received information about the vaccine and you felt that that was a very trusting source, or were there other um, places, whether internet or whatever, that you were able to get other information about the COVID vaccine?
I mean, besides Dr. Fauci, you
Yeah.
know, I listen to Dr. Fauci and I listen to my own pharmacist, and I felt that that was a good source of information for me. So
Mhm.
that's how I, you know, followed the guidelines and, you know, got my vaccines.
Great, great. So you talked about having a little bit of difficulty, in the beginning getting the vaccine.
Mhm.
Um, Back then versus now, the availability to people in the community. Back then, like I guess in the beginning, what were those barriers and challenges of getting the vaccine in the beginning versus now?
Well, when we first did the research to try to get the first two vaccines, it was a matter of like, you know, having to get on the internet and signing up quickly to try to find the pharmacy nearest you. And the closest one to us for the first two vaccines was like 40 miles away
Wow.
because it wasn't available. It wasn't available in Berkeley Heights. So we actually had to go to like a CVS to try to get the vaccine done. And that was, you know, 40 minutes away with, you know, Miggy driving us to the location. It was just difficult.
Yeah.
Now, you know, I'm on the Walgreens able to find it and they give you the dates and times, and it's so much easier, so you schedule it quickly, and there's no barriers trying to get the vaccine or the boosters.
Yeah, good. So how do you think that the state or local organizations could contribute so more people felt confident in and access to the vaccine? What do you think they could have done?
Besides making it more available?
Right.
I just think that was the main issue, just
Okay.
being able to get it close by, and instead of having to find it, 40
An
minutes
hour away or whatever. Right.
Right. I thought that would have been easier if you really wanted the community to get the vaccines that they needed. But
And then,
it's easier now.
right. I mean, I think we all traveled far in the beginning for those vaccines. So,
Yes, absolutely.
and we were fortunate to be able to as well. So, so how do you think that our state and local health departments could improve communication and messages about the vaccine?
There's barely any, I get text messages telling me that the COVID vaccine is available. But about, so to me, it's fine. But what about people that don't have a phone or internet? How do you get those people to get the vaccine? And there are a lot of people that haven't received it or don't believe in it. So, there's still, I think, people out there that have not been able to receive the vaccine because they don't have the capabilities,
They don't have the technology.
Correct.
Yeah. Yeah. How do you, any suggestions on how to reach out to those individuals?
I think a church or a meeting, like a building has, like Miggy's mom has she resides in a over 55 kind of a tenement place.
Mhm.
And, they have meetings for the people that reside in the building. Like you could have like one type of like meeting in that kind of place, or a church. You could have a little conversation after church,
Mm-hmm. Yeah.
I think that's the only way to do it.
Yeah. That's a very good suggestion. Do you think that all of the communities, when you look at this whole state of New Jersey, do you think that all the communities in New Jersey were given equal access and information to the vaccine? And if not, who do you think was left out?
Well, like I said, I definitely people who don't have internet, they don't have a phone. Those people, excuse me, I don't think that they were able to get access to the information,
Mm-hmm.
And I still think that is still true,
Yeah, so definitely something that they need to consider going forward. God
Correct.
forbid something else like this was to happen.
Yeah, absolutely.
Yeah. Last question is there anything else that you'd like to share, with the Department of Health that we didn't discuss about the whole COVID process?
I think the questions covered it all. I haven't, like I said, I haven't had any issues besides the beginning, but I have no issues getting that vaccine. So yeah, I'm good,
Good.
Yeah.
Great.